name is Dr. Katinka and I am author of Taming the Beast, a guide to conquering fibromyalgia. Today I want to cover a few of the very common questions my patients ask about fibromyalgia. The first one I want to cover is, what do I think causes fibromyalgia? Now, this is certainly not universal and it is not the case every time, but very, very often you will find that patients who suffer from fibromyalgia had an old upper cervical injury that was just ignored for the most part. And by that I mean a whiplash injury or even a fall where you fall really hard and it hurts your neck or your tailbone. So those two areas are very intimately connected. You will often find that you have a lot of neck pain. You may have had cervical fusions. You can remember having a whiplash injury even if it wasn't severe. That causes a malfunction of the central nervous system right here. That is called the autonomic nervous system. That nervous system can be divided in two parts. One part speeds up everything and one part slows down everything for the most part. The speeding up part is fight or flight, is sympathetic, and the slowing down part is parasympathetic or rest and digest. You are caught in fight or flight, so you're going to have high anxiety, your adrenal glands are pumping adrenaline all the time, your blood pressure is irregulated, and you're going to have problems sleeping because the parasympathetic nervous system is designed to help you sleep at night. It has to do with your immune system. It has to do with sexual function, so your sex drive will be really low. So that nervous system is the prime cause of most of the symptoms of fibromyalgia, and a lot of doctors do not know this. So patients often ask me, why am I so exhausted all the time but I cannot sleep? It's a great paradox, right? So when you have this autonomic dysfunction, your adrenal glands on top of the kidneys are designed to kick in when your life's being threatened, and they're going to pump adrenaline like crazy. But the thing is, they were not designed to do this 24/7, 365. So eventually you're going to run out of adrenaline and you're going to go in what we call adrenal exhaustion, which in turn will affect the thyroid gland. And so fibromyalgia people are going to have a lot of thyroid issues too. And yet the parasympathetic nervous system, rest and digest, remember, is completely shut down. So that's going to keep you from sleeping at night even though you're so exhausted. Patients will come in and say, I'm like a human weather detector. I know what the weather's going to do. That is so weird, and that is just me. Everybody thinks that that is unique to them. That's actually a very common fibromyalgia symptom. And what causes that? If you have this upper cervical injury and the atmospheric pressure is going up, so we're getting bad weather and it's going to rain, it's going to cause swelling of the soft tissues, and even minute swelling can really make this injury worse, so your pain will increase. In addition, when your autonomic or automatic nervous system isn't working right, your inner thermometer is really messed up, and so cold and heat will affect you much more intensely than most people. Fibromyalgia patients almost always have digestive issues. The autonomic nervous system that I keep talking about really affects this in fibromyalgia patients. And the sad thing to me is that most people do not know about this, and most doctors do not know about this. So they will treat the digestive issues separately. They will treat it, say for instance, like an IBS problem, and they will give you medications for that, or Crohn's disease, and they will give you medications for that. Or they'll say, oh, you're gluten intolerant. So the problem is the electric supply to the building. Think of your body in the same way. When this nerve doesn't work correctly and your nerve supply to the gut is shut down or severely decreased, you now become much more vulnerable to biomechanical issues and also to bad bacteria in the gut. So that is a central nervous system problem, and if you fix the nervous system and help it to communicate again, then your gut problems will improve over time, especially with help. Just a few more things. Your autonomic nervous system and your cranial nerves really have to do with senses, so the sensory nervous system. I always call it the front door to the nervous system. So what you hear, what you smell, what you see. In fibromyalgia patients, these nerves are very confused. So loud sounds, obnoxious smells, or even nice smells but strong smells like perfumes will really affect you negatively. The other thing is speech. The vagus nerve that we referred to before really helps you with speech. So if you have very severe fibromyalgia, that may even affect your ability to move your tongue. So your speech is going to be slurred, it's going to be slower, and it's not your imagination. I hope today's video really helped you. Stay tuned and we'll record more of these. Have a great day.